We here today in San Antonio, Texas, where I've been residing here for about 20 years. I have a family member, we're talking about health facilities today. I have a family member that's been in and out of health facilities for 6 years, since 2013. Was in a serious accident and got put in a position where quadriplegic. And what happened is I've been witnessing the healthcare industry here in San Antonio, Texas, for off and on throughout these 6 years, and I've witnessed some things that shouldn't be happening in health facilities. Um, the thing that shouldn't be happening in health facilities, patients are supposed to get courtesy care. That's not happening here. So I'm like, how can people feel so comfortable mistreating a patient that really needs them real bad? See, the patient that's quadriplegic is more challenging than somebody that can walk for themselves and somebody that can eat for themselves. The patient is more challenging because he needs more of attention than other patients, and especially if they're sick. I mean, if they're really sick, then okay, they need serious care. But then they need to be turned. They can't turn themselves. They need to be moved or whatever. They can't do it themselves. They need their teeth brushed. They can't do it themselves. They need to be clean. They can't do it themselves. And what's happening is in the hospital, nursing homes is just terrible. Most of them, when it comes to a person like a quadriplegic person, they're just terrible. I mean, terrible. Okay, they'll take care of you for a couple of days. After the first couple of days, 2 or 3, maybe 3. After the first couple of days, they just treat you like boo boo. You be ringing, you can't even hit the bell. So, but you can possibly mash. They give you a pancake or some way to push a button. They try to rig you something together to push a button. You push the button, and then all of a sudden you pushing it too much, and they just leave you hanging. They leave you hanging. So, and then when you need to be turned, they don't come and do it. They say orders to be turned every 2 hours. They don't come to do it. They don't come to do it every 2 hours. They don't. They start out treating you right, and then they start treating you all bad. They start ignoring you and everything. They don't understand the person that can't do nothing for themselves needs attention. They need more attention. They put you right there in front of the nurse's station, but what for? Nurses over there laughing, giggling, talking, looking at the light going off and everything, hear the beep and everything. They still over there jiving and bull jiving around. This has happened many times in many places. So I'm beginning to think the healthcare system here is not really up to. It's not really. I don't want to be hateful about it, but I don't want to ever be in this condition where I depend on these people to take care of me for anything. Because I'd rather put a gun to my head and blow it off first before I go into one of these facilities and allow myself to be taken care of by these no good, inconsiderate, uncaring people. And then the night shift is worse than the first shift, okay? Because the night shift, you really going to be left to yourself. You understand? You're going to be left to yourself. You're going to be ringing a bell. You're going to be needing somebody, and they just shut the door on you. You understand what I'm saying? This is down here in San Antonio, Texas, man. This health, they charge you all this money. Charge your insurance companies all this money. You understand what I'm saying? And they charge you. And then they turn around and mistreat you, treat you like boo boo, boo boo. I'm talking about, man, they do not care about you. You hear me? They get smart with you. You're a patient. They're getting paid to take care of you. They give you attitude. You understand what I'm saying? And then they want to get you out of the facility. Instead of them checking their work, their employees, they pushing to get you out of there because they don't want you there, because you need too much help. What kind of healthcare system is this down here? Huh? It's terrible. Absolutely terrible. Don't come down here if you really in real dire need of some help and find yourself in one of these facilities. And soon as if you ain't got your family there to watch your back or to get somebody in there for you, you're going to be messed up, man. Messed up. And these boogers always trying to run you out of the hospital before you even get well. Yeah, they talking about the insurance company won't pay. The insurance company.